Hi, I'm Dr. Drew Varano. I like to give a quick synopsis on liposuction and keep this under about 6 minutes. Just the highlight points of the consult. Obviously, we tailor each consult to each individual, so this is a generalization and not all-inclusive. There are many types of liposuction that you can read about, but they all basically do the same thing. It's removal of fat and then the ability to tighten skin by using a form of energy. We like to use J plasma here, also known as Renuvion, which can be added on in probably a third of my cases to help tighten skin if the person is a candidate for that. So starting off, basically the first step is we have to do anesthesia to numb you up. We like to use local anesthesia here. There's options to use general or twilight. We use local because it's safer for the patient, it's a quicker recovery, and it's also more economical. So it's win-win-win. So step one, we do the local anesthetic. In order to do that, we make little prick incisions. The prick incisions are about 3 millimeters big, so smaller than a pencil head eraser. So if I do an abdomen, which is typically done, we do one in each groin, one above each love handle, one on each lower side of the back. We can treat arms, which require 2, one here and one here. Necks may only require 1 or 3, just depending on what we're doing. You can treat back areas, you can treat bra rolls, you can treat inner and outer thighs. So there's many areas to treat, but they all require the same local anesthetic to numb you up. So what local anesthetic is, it's just saline mixed with lidocaine mixture and a cocktail to numb you up. So I usually tell people for an abdomen, that usually takes about 20 minutes to do. So once we make the little prick incision, I insert a cannula, which is a small skinny device, skinnier than a strand of spaghetti, and it's inserted underneath the tissue and it pumps fluid. It's an irrigation system. It's going to pump water mixed with lidocaine and epinephrine into that tissue. So we get the right lower side, the right upper, and systematically move it around to get the whole area numb. Now I usually tell people that's the only part of the treatment they'll feel anything. On a pain level, it's tolerable. I would say if 10's the worst pain and 0 is no pain, typically it's about a 3. If the skin is looser on the individual, they will find it more comfortable, which that's another topic of discussion. But so step one, we numb you up. Once you're numbed up, then the second step is to go in and remove the subcutaneous fatty tissue. So that's the fat that's directly in front of the muscle and beneath the skin. It's very accessible, and typically speaking, we can remove 60 to 80% of that subcutaneous fat. So those same incision sites that we did for the anesthetic are the same access points that I use to suction out the fatty tissue. That part of the treatment for an abdomen will usually take about 30 minutes or so. And the patient really feels not much of anything. They may feel a little bit of vibration. Some people may say it tickles a little bit even in certain areas, but that allows me to suction out adequately the fatty tissue, and once it's removed, it's suctioned out and it goes in a container such as this below where we can see the fat being disposed. So again, step one is the anesthetic, local anesthetic. Step two is the removal of fat. Step three is, for some people we do this, for some people we don't. I would say in about a third of my cases I do. If a person has poor skin quality, meaning they've had multiple pregnancies, elderly age, they've lost a lot of weight, maybe genetics, but if the skin quality seems to be a little bit loose or stretch marks or whatnot, we can tighten it up, which we were not able to do many years ago. And we can tighten up with a very high degree of tightening, better than other systems such as laser. We're using 2 forms of energy, radio frequency and plasma energy. And what it's doing is, this is my third step, I can go through those same access points with the device, which is about smaller than the width of a pencil. And I go underneath the deep layers of the skin and go back and forth, tightening it up. Again, you don't feel anything because you're numbed up, using the J plasma energy. And this helps shrink wrap the skin and tighten it up to give an overall better effect. And again, it's only utilized for those clients who may benefit from it. So to reiterate, step one, we do the anesthesia. Step two, we do the fat sectioning. And step three, we tighten the skin, and then that's it. And once that's it, you're done. Once you're done, there's no sutures or anything. The incision sites, you'll have a little seepage of the anesthetic fluid for 24 to 36 hours. But we're going to wrap you with absorbing pads and some wrap like this. and wrap you up. You can take that off the next day. The seepage should stop. But we'll also provide a compression garment that you're going to wear underneath your clothes. It's like a Spanx, and whether it's the arm or the neck or the body. The neck, you only wear it for 3 days. For the body and the other areas, you're going to wear it for 3 weeks underneath your clothes. Nobody knows you're wearing it. And then I say you should start to see results usually in about 10 to 14 days. They'll progressively get better with time, but usually at 1 month, you're about 65% done with the final results. By 2 months, you're about 80–90% done with the final results. Results will continue to improve up until 6 months, and then it kind of everything stabilizes. I usually tell people in terms of recovery time, just take 1 or 2 days off work. You can do normal activity. People can go out and walk their dog that night and do normal stuff. But in terms of heavy exercise, I usually tell you no heavy exercise for 1 week. By week 2, intermediate to light stuff. By week 3, you do whatever you want. And then in terms of the treatment safety itself, it is local anesthesia, so it's the safest anesthesia available that minimizes the risk of blood clots like general anesthesia, so there is not an association of that issue. We also watch for infection, which is rare, so just a precautionary, we usually put you on an antibiotic that you take day before, day of, a couple days after. We also watch for what's called a hematoma, which is a collection of blood or a collection of fluid known as a seroma. Usually if those occur, they're very rare and very mild with the local anesthetic. So if that does occur, it's usually self-limiting and resorbs on their own. Last thing we talk about is what's called contour irregularities, like divots, dents, things like that. That you can have a little lumpy, bumpy period at the beginning, but usually that smooths itself out within the first couple weeks. It's not very noticeable. It may be to you if you run your finger over the tissue, but I would say less than 3% do cases occur. And if it is, they're very amendable with a quick little touch-up procedure. But again, it's a very rare phenomenon that occurs. I hope this has been educational for you. And like I said, we have prices listed at the end here. We also have much more information on our website. And that's it. Thank you.